I'm going to talk something about a glycemic wheel. So I have a copy of this wheel, so anyone is interested can get this wheel from us. So what we did is, like in glycemic wheel, a visualizing nutrition to reduce the HbA1c and improve literacy rate among the type 2 diabetes. So if you see, in 1890s, this is the famine in India, where we had one meal a day. Today we have meal all day. So this is the reason why we have a lot of diabetes in our country. And I just wanted to put one slide on the history which has been suggested by the organizing committee. So our aim was very simple. We all talk about, first it was fasting, then we said fasting HbA1c needs to be fixed. Now we have moved into time and range, and probably we have moved into more. Similarly, in diet, all we are talking about is carbohydrates, lipids, and other metabolisms and how to reduce it. But people really don't know what to do. So now is the time that we shift from just saying carbohydrates all the way to low glycemic index. But there is no ideal tool. Whatever diet sheet you give, you see most of the time it is within the patient's file, kept neat and clear. Nobody uses it. Really nobody follows it. So it doesn't make anything. So there is no engagement in this and diet chart, and counseling doesn't translate into change. Most of the time within our 5 or 10 minutes we counsel them. They hear it in this ear and goes out as soon as they leave the chamber, or probably before that. So we decided what can we do really to change this, and that's how we came up with this idea. The aim was to identify the basic food. For example, we have grains, we have snacks, we have pulses, vegetables, milk products and fruits. So we combined all of this which is commonly used into a circle, where the patients can choose between high, low and moderate glycemic index, and it can also be kept as a fridge magnet. It can be kept on the table, it can be kept on our, even on corporate offices, it can be kept on the table. So that was the whole objective. And we wanted a tool where people get engaged with it. So by that way, diet and your food related, glucose concentration, patient education, HbA1c, everything is being put into it. So this was a prospective 12 weeks intervention trial. So we gave all these tools to the patient during our counseling session. If you see in this intervention, this is a rotating wheel tool. So where you can rotate most of this, I can give one copy to all of you. So rotating wheel, you have food groups as I suggested, and then we gave this to all the patients. We enrolled 3,185 patients who are engaged and for the feedback of the tool. And in the intervention cohort, we had 1,254 patients and followed up their HbA1c reduction only by giving this tool, not altering any of their medication. And then we assessed the dietary adherence, how much did they follow, HbA1c and patient reported usability and comprehensive. Before which we validated this tool and did an analysis. In this validation, we found out that the CV average value was 0.91, which was excellent. There were 30 physicians who validated it, 50 dietitians who validated across the country. And when we came to the patient engagement, 2,680 participants rated this glycemic wheel was really useful because they never knew what the glycemic index was in the first place. So it was extremely useful for them, it was new for them. And 97 participants, that is 3,090 participants, found the information to be very easily understandable. And it was highly acceptable across all the literacy rate, because this wheel can be customized from patient to patient. We have a digital version where you can input whatever you take, and then it gives you an output, and you can make a wheel right in your own OPD and then give it to the patient. And it can also be in any languages, n number of languages. And then the dietary adherence completion, we try to get this adherence, and you see 32 participants were actually there at the baseline. But post-intervention, 72% of these patients had dietary adherence and significant adoption of low glycemic food. They were excited. More than the results, they immediately, as soon as they came in, they were talking more about the wheel rather than the results which came out. And if you see the mean HbA1c reduced from 8.3% to 7.1%. By just giving them a simple tool, making them understand what it is, we can see a reduction of 1.2% just by a small intervention for these patients. At conclusion, the glycemic wheel is clinically meaningful diabetic self-education management tool. Dietary literacy rate is high, but we need to tell the patients how, keep them engaged. The dietary adherence needs to be kept engaged. Limited diabetic knowledge. From there, you move to the self-diabetic education tool implementation, improved literacy rate, and then you have improved dietary adherence and improved glycemic outcome. Why it works? It's a rotational, rotating, meaningful design. It is easy to use for anyone at home, from child, from all the way from children, all the way to adults. And then it reinforces the moment of food choices that you have to make, because this wheel can also be fixed as a fridge magnet. It can be fixed in many other ways. Encourages repeated engagement beyond the clinic, sustainability and spreads, and the integrated OPD management workflow will actually help. And then you see the reproducible multiple languages can be done. Quarterly updates can be given to these foods, and scalable at the level of the community. Even at the last unit of the primary care, it is easily scalable. In clinics, it can be distributed in camps, it can be given as digital platforms. So the future of this scope will be much higher. We are validating this more and more with more number of participants to see how well it works. And in this wheel, if you can see, it also says the portion size, it gives the glycemic index rate. It also gives the disclaimers, because most of the time this GI index, it depends upon how you cook the food. So that also, the disclaimer is being given in this. And for vegetarians, there are separate disclaimers on how it is being calculated, and for non-vegetarians, and tips to how to maintain this wheel and how to move forward. With this, thank you so much for giving this opportunity.